is the diabetic capital of the world, and the diabetes can cause various problems in multiple systems in the body. And one of the common effects of diabetes is peripheral arterial disease. What is peripheral arterial disease? Basically, the blood which is supplied to the leg through the arteries, they can get affected because of diabetes. Because of many other causes also, these arteries can get affected. And one of the other most important cause for the arteries to get affected in the lower limb are smoking. So whenever there is a lack of blood supply into the lower limb, we call it is a limb ischemia, which can be acute limb ischemia or chronic limb ischemia. So now what I'm trying to say is a peripheral arterial disease is a group of diseases which basically affect the lower limb. Most common cause is diabetes, and then second most common cause is smoking, and then there can be atherosclerosis, one of the other causes, and there could be a thrombus or a clot in any part of the body which can probably migrate into the lower limb and occlude one of the blood vessels. So this is called peripheral arterial disease. Now with interventional radiology, we have excellent group of treatment that is available for treating peripheral arterial diseases. The basically peripheral arterial disease means there is an occlusion of the artery of the lower limb. Hence the blood is not getting supplied from the occlusion distal to it. So what we do in interventional radiology is we do a small little puncture in the arteries in the lower limb, and we just cross that thrombus or the clot, and then we do angioplasty, open up the blood vessel so that the distal blood supply to the occlusion is much better, and if required we put a stent. So there are many people that think that a stent means it has to be only the heart. No, whenever there is a requirement to keep the blood vessel open, we put a stent right in the brain, in the carotid, and in different parts of the body, also in the legs. So peripheral angioplasty and stenting are different types of treatment available through interventional radiology for treatment of peripheral arterial diseases, and this is possible as a minimally invasive, no cutting, no stitching involved in it, a minimally invasive procedure, a couple of days of admission, and we just do an angioplasty, open up the blood supply to the leg, and we completely get the revascularization done.